These episodes are characterized by feelings of a depressed or sad mood along with a lack of interest in activities. It may also involve feelings of guilt, fatigue, and irritability. A major depressive episode is a period characterized by the symptoms of major depressive disorder. Sufferers primarily have a depressed mood for 2 weeks or more, and a loss of interest or pleasure in everyday activities, accompanied by other symptoms such as feelings of emptiness, hopelessness, anxiety, worthlessness, changes in appetite, problems concentrating, remembering details or making decisions, and thoughts of suicide. Biological, psychological, and social factors are believed to be involved in the cause of depression, although it is still not well understood. Emotional pain and economic costs are associated with depression. Treatments for a major depressive episode include psychotherapy and antidepressants, although in more serious cases, hospitalization or intensive outpatient treatment may be required. Nearly every day, the person may sleep excessively, known as hypersomnia, or not enough, known as insomnia. Insomnia is the most common type of sleep disturbance for people who are clinically depressed. A major depressive episode can often follow an acute stress in someone's life. Evidence suggests that psychosocial stressors play a larger role in the first 1 to 2 depressive episodes, while having less influence in later episodes. The 2 main symptoms in a major depressive episode are a depressed mood or a loss of interest or pleasure. These symptoms must be present for at least 2 weeks and must be causing significant distress or impairment in functioning. The treatment of a major depressive episode can be split into 3 phases. First, acute phase. The goal of this phase is to resolve the current major depressive episode. Second, continuation. This phase continues the same treatment from the acute phase for 4-8 months after the depressive episode has resolved, and the goal is to prevent relapse. And third, maintenance. This phase is not necessary for every patient but is often used for patients who have experienced 2, 3 or more major depressive episodes. Treatment may be maintained indefinitely to prevent the occurrence and severity of future episodes. Some causes of depressive episodes are history of suicide attempt or self-injurious behaviors, family history of suicide or mental illness, recent severe loss, poor health and lack of social support. Both manic and depressive episodes can be frightening for both the person experiencing these symptoms as well as family, friends, and other loved ones who observe these behaviors and mood shifts. Fortunately, appropriate and effective treatments, which often include both medications and psychotherapy, can help people with bipolar disorder successfully manage their symptoms. Remember, if you know someone who's in depressive episode, please resolve and never ask them why. Depression is not a straightforward response to bad a situation. Depression is just like the weather.